Awesome. We've got a big group today, and I'm so excited because today we're going to be moving. We're going to get out of positions that you normally are in and put you in positions and do things that you're not comfortable with. That's okay. You know, we want to think out of the box, get out of our comfort zone, and remember, if it doesn't challenge you, it's not going to change you. All right. My name is Dr. Paul Kachoa, and I'm with Better Spaces. And Better Spaces is a health and happiness solution for today's hybrid workplace. I'm a physical therapist and certified golf fitness professional and also an orthopedic clinical specialist. I'm here at my clinic in Randolph, New Jersey, and we're going to go over a very easy and educational workday session. Let's get started. I'm going to pull this up here. This is the title of today's session is going to be our office athlete workout. So everybody is, adults who are working, and if you're active, you work hard, but also you like to play hard. This is for you. This is the session for you. I know it's totally cliche, but if you're at work right now and you think, oh, it is Tuesday, I wish, Friday would come, this is for you. All right. So one of the things we want to keep in mind is that your body adapts to the positions and postures you put it in. If you are stuck in one position for a prolonged amount of time, your body's going to adapt to it. You're going to lose the ability to get into other positions and other postures. All right, think about it this way. The rule is that you should not be in any one position for more than 30 minutes. 30 minutes is going to be the time cap that you have to move. I think that, people ask me all the time, how should I sit? What is the perfect posture for sitting? The truth is that there's no perfect posture. All right. Our bodies were not moved to stay in one position for too long. We're designed for motion. All right. So not only is it sitting for too long, but also the lack of motion, combining the two, which creates a lot of issues with our body. Okay. Now, just as a disclaimer, if you've been to one of my talks before or one of my webinars or classes, this is not physical therapy. It's just general advice aimed at a broad population. And if you're dealing with something specific, an injury, some type of ache or pain, please consult a medical professional so that you can get a thorough physical exam and develop a individualized program that's for you and can address your root causes. So this is another shot I always bring up, because if you come to any of my talks and you remember one thing, remember this, that the body functions on this alternating pattern of stability and mobility. All right. If this pattern is disrupted, then we've got pain or injury, right? So think about it this way. A lot of times people will come to me and it's like, oh, I have a back problem or I have a knee problem. And if we look at this illustration here, the back is a stable segment. The knee is a stable segment. When those segments become problematic or they have pain, it's usually because of something above or below. The back usually becomes a unstable segment because the hips or the T-spine, the thoracic spine, is not mobile. Or the knee has pain because it becomes unstable because of the hip or the ankle is not as mobile as it should be. So think about that. Take that home and remember that the body functions on this alternating pattern of stability and mobility. If it's disrupted, pain or injury is usually the result. So whenever you go to a doctor and say, oh, my knee hurts, oh, I have hip bursitis. Ooh, I had a lady come up to me today and said, I have hip bursitis. Well, I was going to say that it's probably not your hip. There's something else going on above or below the chain that we need to address. All right, let's get into it. The things that we're going to go over today, we're going to go over some sitting stretches to address these areas here, hip, shoulders, back, neck, and then we're going to work on some muscle activation. All right. A lot of times when we sit, hang out for prolonged periods of time, our body shuts off. The muscles shut off. We want to wake them up. All right. So let me pull this up. I've got my 2-shot here. We're going to get into it. So I've got this set up. I've got my chair. This is my desk. I'm sitting. I've got my box here. I'm at my clinic here, so I don't really have a desk. I have a box, which we do exercises on, but this will be functioning as my desk. So the first thing that we're going to do is we're going to get off of the back of the chair. We don't want to be like sitting kind of relaxed. All right, we're done. We need to be more active. We're going to turn on some muscles by unsupporting our back. And we're going to stay in this straight position. We don't want to slouch, right? And we don't want to be totally overextended where there's like way too much tension in my lower back. I want to find some happy medium so that at least I'm not touching the back of the chair. All right, we're going to start from the top down. From here, what I'm going to do is I'm going to take my hand and do the little classic upper trap stretch. But as we do this, the big thing is that this whole side needs to stay put. So we're going to take the left hand, hold on to the chair, sit up nice and tall so this shoulder stays down. And then as we pull, we make sure that the head remains totally forward. We're not rotating as we pull, and the chin isn't going forward and we're pulling, okay? So it looks like this. I'm just going to reach directly over, and I'm going to pull. As I pull, I feel this stretch going down the side of my head, side of my neck, maybe into my shoulder. Again, if you look at the side view, here's my side view trying to get into that camera. I don't want my head to be forward and doing it. Ugh, doesn't feel great. I want to be here, all right? And then my head is always pointed straight ahead. 30 seconds per static hold, all right? Let me pull this down here. Maybe you can kind of check at both angles, all right? So let's do the other side. I'm going to put my right hand, hook onto the chair, stay up nice and tall, keep my chin in, don't let my chin jut out or my nose point off center. I'm going to reach around and up and over with my left arm. I'm going to pull. And again, we're going to hold that for 30 seconds. So this is a classic one. A lot of times people would just crank it way too much and they start to search for the stretch because this section, this end or the origin of the muscle is unstable. We want to make sure that we get a good grip that stays down and that doesn't move as we pull away. And it doesn't take much. Now, if you're pushing too hard into pain and your body starts to fight against you, it's way too hard. All right. Think about, we want to create lengthening and relaxation of that muscle. And to allow it to lengthen, we have to allow it to turn off. When you're stressed out and you're trying to get into a stretch too aggressively, the muscle will tense up and fight against you. So we want to breathe through it, long exhales, relaxation, center ourselves over as we go through there. All right, the next one I want to work on is your wrist. So the wrists are notorious. We're sitting here doing our thing, developing that repetitive stress injury syndrome, mousing around, typing or whatever. We're just going to interlock the fingers. Again, this is another simple one. We're just going to take those fingers and palms and push them out as far as you can. We don't have to necessarily round out the back, but if you feel like you need to get a bigger stretch in your back, we're going to push out from there. Just make sure that the fingers and the palms are facing away from you as you go. Okay? And again, gentle, long 30-second holds, not doing anything crazy with this. Now we're going to take that hand and see, can we bring that up, exposing the palms to the ceiling. If you have some shoulder issues, don't go that far, but we really want to push those palms away and just kind of bring them up over your head, okay? And then the next one, as we get into this, is to try and stretch out our trunk. The trunk or the thoracic spine, we get stuck into this position like a caveman, Neanderthal, just kind of pecking at the keyboard. We want to open up that midsection. So depending upon the structure and the height of your chair, you can do this. So this is the one time that I'm going to lock myself out. And let's see this chair, if I could lock it, perfect. So some of the chairs that you might have lock or they tilt in space. So make sure it's locked for this one. Get a wide stance. Get yourself stable. My lower back and my hips are as deep into the chair as possible. This is going to be tricky. If you fall out of your chair, don't go that far. All right, we're going to take the hand, interlock the hands, put them behind the head and bring your elbows forward. This is key. Bring the elbows forward and we're going to keep those nice and tight. We don't want to do this here because again, this is in suboptimal positions and we're just going to be searching for the stretch. You want to get nice and tight, elbows together, and then we're going to push those elbows up to the ceiling. If you start to hit the back of the chair, you can come away from it a little bit, but we're really focusing on trying to keep those elbows tight, wide stance, so you're totally stable with the lower body, and then push those elbows up to the ceiling. Take a deep breath in, and then exhale as you push even higher. If you can lean against the back of the chair, that's great. Depending upon the height of the back of the chair, it might be a good pivot point for you, but don't go too far back that you might fall out. Deep breath in, And then exhale as you push those elbows up even higher, extending through the thoracic spine. All right. Next, we're going to work on the hips. The hips remain in this tight flex position. What tends to get tight is this whole front line here, the hip flexor and the quad muscle. So again, we're going to come to the front of our chair, turn ourselves as much as we can, 90 degrees, and I'm going to bring my hip back. Let's see if that's on camera. I'm going to scooch back so you can see. And my goal is to try and get this hip and knee open. The hip is open. It's not closed like this one. I'm straightening this out so I feel this stretch. My knee is down. If it touches the ground, great. But I've got my toe and my heel up on my other leg, my back leg over here. And then from here, I can hold on to my chair for balance so I don't fall off, or hold on to the armrest here. And I'm just going to stay as tall as I can, using my foot to wiggle that leg as far back. So I'm really trying to lengthen this leg here. And then bonus points, if you can do this, you're going to take your right hand up and over as high as you can, and then side bend away to the left. So I'm really opening that whole left side. Since we're using the trunk, we're going to take a deep breath in, and then exhale, because that'll pull in all the structures that are stuck down and allow us to stretch through the trunk as well. All right. So I'm going to show you on the other side, and I'm going to face the camera. So I'm on my side of my chair, right? Precariously on the edge. Take my outside leg, my left leg, scooch it as far back as I can. Lock that toe down. I'm holding on with my right hand onto the seat or the back of the chair. I'm going to stay nice and tall, and I'm going to take this left hand up, and then I'm going to take it to the right, over the top of my head, and then once I get to a point where I feel like, oh, I can't go, I'm going to try and eke out a couple more inches of stretch by using that breath. Deep breath in, and then exhale and fall into that deeper stretch. Again, pain-free range of motion. Another deep breath in, and then exhale as you push into it, fall into that stretch, opening that whole lateral line and the front line of your hip over there. That should feel really good to open up that back and the hip. All right, now we're going to stand up to get the ankles. So the ankles, super tight sometimes. So what we're going to do is we're going to put both hands on the desk, and then we're going to bring one foot back. Now, it's important that this back foot is going to stay flat, and the foot is pointing in the same direction that I am facing. If you're looking down and the foot is pointing out, so if I'm going to show you from the front here, my left leg is going to go back. I want that foot to be pointed straight ahead. I don't want it to be pointed out like that. All right, so I'm going to be supporting my body with the desk here. I'm going to slide that back, make sure I'm looking down, that heel is on the ground, my foot is totally forward, and I'm going to straighten out that knee, that back knee straight, and I'm just going to bring my hip forward. This front knee is going to bend a little bit, but really, if I keep that back heel down, I should feel that stretch in that calf. Again, 30 seconds, give it like 2 or 3 deep breaths. That should be sufficient if you're not looking at a clock. 30 seconds is the bare minimum to hold any static stretch to create a permanent change in that tissue. Then we're going to switch sides. So again, take that other leg back, make sure that right foot is totally straight, drive that heel into the ground, checking, all right, my foot's straight, pointing where I'm looking, and then we're going to push that heel down, get that calf stretch, 2 or 3 deep breaths that allow that muscle to relax, tap into that rest and digest nervous system instead of the fight or flight nervous system, right? When we get into a stretch, we really want our muscle to relax, and that's why we really focus on the breathing, long, slow, deep exhales, and then that's the end for that stretch. Okay, so now we've got everything kind of loosened up. We're going to get back into the chair and to work on some glute sets. So this might be tricky because you, on camera, it might not look like nothing's going on. So I'm going to try and get into an angle here. You can see you're going to put your hands right on your glutes. That's your butt cheeks. All right. So we're going to be here, and then we're going to try and can we contract the glutes? All right. Can we squeeze the butt muscle? All right. So I'm not moving, but I'm squeezing. I'm contracting my glutes. Oftentimes, because of prolonged sitting, we have that muscle that we're sitting on, that piece of meat being compressed, and the temperature gets elevated because of our body temperature. We're just tenderizing that glute muscle, and then we oftentimes have a hard time contracting or controlling it. So we've got our hands here to palpate. All right, can I feel that muscle get tense? I'm contracting, relaxing, contracting, relaxing, and then can we have enough control to do one and not the other? So again, not much going on in terms of visual, but the real feel is, can I contract my right and keep my left relaxed? Difficult. Can I keep my right relaxed and contract my left and then go back and forth? Right cheek, left cheek, right cheek, left cheek, right cheek, left cheek. All right, so we do that a couple times just to wake them up, and then we're going to work upstream a little bit to the shoulders. We're going to get to that edge of the chair. We're going to sit up tall. Chin stays level. Head nice and long. Imagine a piece of string coming up to the top of your head, pulling you up to the ceiling, elongating the neck. We're going to drop the shoulders down, palms to a forward position here, and extend our fingers down into the ground. All right, so there's the side view, trying to get those fingertips into the ground, palms facing forward. And then here's the front view, up nice and tall. If you're blocked with the armrests of your chair, you can go a little bit wider, but the final piece is to try and push those palms and hands back without arching your back. You want to try and keep those ribs down, abdominals on, but head nice and tall. There's that string coming out the back of top of my head, fingertips to the ground, pulling my shoulder blades back and down. You should feel that contraction between your shoulder blades. For this, I like to hold for at least 30 seconds to a minute. So you feel like we're working and then waking up those muscles. These are your postural muscles that hold you up and keep your shoulders healthy. So once we kind of do that, we can relax out of there, and then we're going to get into a shoulder workout here. So we're going to take those elbows, straighten them out, and your hands out to the side, and we're going to rotate the palms up and then rotate palms down. All right, here's the side view. I'm lined up, my ribs are down, my core is engaged, palms up, palms down, palms up, palms down. 3 more, rotating up, rotating down, rotating up, rotating down. Now we're going to move into a transition in what we call a Cuban press. You're going to make a shape like a field goal. Field goal. Arms are like this. Can you keep your elbows still and then rotate the hands down so that the forearms are kind of pointing down, but we don't want the shoulders up to the ears. Again, remember, we want that tall neck, string pulling out the top of your head, elbows bent, and then rotate down and up. This is a tougher one for the shoulder, rotating around the shoulder joint, but not hiking the shoulder. If your shoulders are tight, you can't get down below parallel, that's fine. You go to where you can tolerate, go to where you can go, all right? But we definitely want to try and get our hands vertical without moving the elbows. My elbows stay put, that's the pivot point. Here's the side view. Pivot point is the elbow, not moving the elbow, rotating up, locking in my shoulder blades down and back, head nice and tall. We're going to do about 10, do 2 more, and then we're going to go into a squat. All right, so the squat, we're going to work on lower half. For this, level 1 is going to be hands on our desk, sitting at the edge of the chair. We want to get our feet flat. Keep the weight mostly on our heels. Keep your knees apart. And then you're going to stand up and then come and sit, touch lightly and come back up. Okay? So that should be super easy. The key points here from this side view is that my knees don't go forward like that and my heels stay down. I keep the weight on my heels as I come up and down, touch lightly and come up. All right, keeping the head nice and tall, leaning forward a bit and then coming up, right? So I don't want to kind of round out and go down like I'm bringing my chin into my chest. I want to keep that separation from my chin and my sternum and then just go down and then stand up. And then if you want to see it from the front view, again, here's my feet. I want my feet about shoulder width apart. My weight is going to be mostly on my heels so that my knees do not go forward and they do not go in. All right, we don't want those knees to go in because that'll wreck the knee joint. I can pretend I'm holding onto a desk here and I'm going to lean forward, stand up, and then lean forward, touch lightly and sit down, stand up. So you can see from the front, my knees do not go in. I keep them wide as my feet. And I know that most of you out there said, oh, I gotta keep my knees out. Let me put my feet out wider. All right, so keep my knees out. I'm gonna position my feet wide so I keep my knees out. What ends up happening is that we put our feet this wide, the knees have to stay that wide. They come in like this, and then the squat looks like this. You come up and like, oh, I got my feet wide. Can I keep my knees wide? Then it becomes a very inefficient and painful motion. We want to keep those feet about shoulder width apart and use the glute muscles here to do this, basically. Push your knees apart. That comes from the glute, and that helps to reduce the stress on the knee when we're doing repeated squats like this. Okay? So let's do about 5 more, and then we're going to call it a day. So hopefully this will get your heart rate up a little bit, get the blood moving one more time, and then that is going to be our office athlete workout for today.